Commonwealth Eye Surgery also offers LASIK and PRK surgery, corneal refractive surgery, to help improve uncorrected vision simply by changing the shape of your cornea. If it's a little steep, we flatten it. If it's a little flat, we steepen it. Collectively, we've done probably over 40,000 individuals over a space of 20 years. That experience is very important in trying to decide the proper technique for you. But in addition to that, we've actually kept our technology up to date too.
So LASIK has evolved, so we're in our fourth or fifth generation, and the laser we have is the Wavelight EX500. That's kind of technical, but it's important to know what technology and platform you're going to be receiving here. And we also have a femtosecond laser that will be creating the flaps, another important piece of technology to make sure that you're real comfortable and safe. But the topographic guided LASIK is really that latest generation of LASIK. You think about aircraft like fighter planes, it's like the latest generation of fighter aircraft. So when you look at a cornea, there are individual lumps and bumps that are sub-micron level. So we're talking about really invisible to the human eye. But we have a Vario device that analyzes over 20,000 points on the cornea to see if there's any really small areas of irregularity. This is not something that your glasses or contact lenses could fix. So with the laser, we're actually able to identify these very small irregular spots, and we can create a treatment plan to not only take care of your nearsightedness, farsightedness, or astigmatism, but actually enhance your vision to get rid of these little variations in the smoothness of your cornea, so that, for example, when you're driving at nighttime, we might get rid of some of the starbursts, or having glare issues that you might have right now with your contacts or glasses. We're actually able to give you a result that hopefully might actually improve your uncorrected vision beyond what is even you're capable of with your glasses or contacts right now.
It's a really amazing technology. Once you understand how it all works and what we're treating, it's kind of baffling how precise we've become. Originally we did standard treatments which treated the cornea like with just one prescription, and it created a lot of side effects, some glare and halo or night vision disturbances. The quality of vision wasn't as sharp, the 20/20 rates were not as high, and there were also something called enhancements where you go back to fine-tune the vision. Now we do a truly customizable treatment with a Contura, which measures the shape of the cornea, plus the glasses or contacts prescription. So we're doing beyond what your glasses and contacts are treating, which gives better quality vision, better night vision, and even less enhancement rates. The customized treatment not only looks at the shape of your cornea and your prescription, and so it's like an individualized treatment for each eye, but it's also customized in that there's an eye tracker, which is an infrared camera that locks onto your pupil and treats not just the center of your pupil, but the actual visual axis that you're looking through, which is even more precise than before in terms of the custom treatments. This does lead to overall better vision for you, better quality vision, and actually a quicker recovery as well.
The results on this, before when we started a lot of this stuff, 20/40 or better, which is okay vision, but it's not great vision. Then it came down to 20/30, 20/25, and we started hitting 20/20 regularly with LASIK and PRK. With these new topographic advanced treatments, we see visions of better than 20/20. We see 20/50, we see 20/12.
So is everybody a candidate for LASIK or a good candidate for LASIK? Well, that depends on the prescription of your glasses, the amount of astigmatism, the cornea shape, the cornea thickness. We look at all that information and then make a plan that's best for you, not just for your vision now or the day after surgery, but for the rest of your life. Sometimes patients are not good candidates for LASIK. Maybe the cornea is too thin, maybe the prescription is too high, or maybe the cornea shape is a little bit irregular. In that case, we may offer something else called PRK, which is still all laser vision correction. It still can be contour, it's still a customized shape of the cornea, all the technology we use for LASIK, but there's no flap created. The difference there is the vision recovery is a little bit slower, but in the end, the results will be equal to LASIK and safer for certain patients based on the measurements in your exam.
A lot of people don't really understand what LASIK is or what happens during the LASIK surgery procedure, so we thought we might explain that a bit. When you come in, we're going to make sure that you're sedated. We're going to give you some medicine like Valium to relax you, so hopefully when you go back, you're feeling a little groggy and not anxious at all. But when you lay down, we'll coach you through the whole process. So that's one thing, is you're going to be hearing our voices. We're going to be coaching and guiding you through the whole process. To start, we're going to be making what's called a flap if we're doing LASIK. If PRK is done, we're not doing the flap, but during the flap, your vision will black out for about 30 seconds. That's probably the most intense part of the procedure, and during that, the femtosecond laser is actually making a image-guided, very specific depth flap. And with that, it's partial thickness, and once that's created, we reflect the flap back, and that exposes what's called the corneal stroma, or the middle layer of the cornea. And that's where really the action happens with LASIK. That's where we're going to be reshaping or resurfacing the corneal shape. If you're nearsighted, what that means is we're basically going to be flattening that area. And if you're farsighted, we're going to be steepening that area. And the laser has an algorithm that is all programmed in based on your prescription and the Contura evaluation to very specifically resurface that stromal bed. If you have astigmatism, we're going to be also getting rid of the astigmatism there. Once the laser treatment is done, we'll basically put that flap back down, put a few eye drops on your eye, and we're done. Really, this doesn't take more than a couple of minutes to do and requires your participation, but with the right sedation, most patients do really, really nicely. And honestly, you know, the next morning, most people will come back in and they're absolutely thrilled with how well they're seeing.
One of the major concerns is, doctor, once my flap's up, what happens if I turn my eye? You know, am I going to mess up my surgical result? And the answer is no. The infrared tracker samples and responds about 50 times a second.
Yeah, the eye tracker is extremely fast, as you mentioned, and so if it's not tracking your pupil, it's not treating. It's only treating while it's being tracked, so you can be rest assured that if you make a sudden eye movement, or if you're not perfectly still, it's not going to create a problem. The laser is super fast and super precise, making sure the treatment is perfectly centered where it's supposed to be.
So with all that in mind, we just want to thank you for choosing Commonwealth Eye Surgery. We know that you could have gone anywhere, and we count it as a high privilege to take care of you. So can't wait to see you and get to know what your visual needs are and deliver you a good outcome.